Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It's 9:00 on Friday, and you are watching Friday Friends with me, Deb Burton, Executive Director of RI Elder Info, where every week I bring you information and resources that you or someone you know needs to know about. So please help us get the word out. Hit the like button, the share button, the follow button, the bells, the whistles, all those social media cues that say, hey, check this out. My guest this week is someone who is an expert in her field, both looking at things globally, nationally, at the state, and right here in the individual communities. And truth be told, she and I have been in a lot of meetings together, and she is such an expert that I'm always in awe when I listen to her, and I'm a bit of a fangirl, so you might see me geek out a little bit. So really important that you hit the share and the like button, because Linda is an amazing person that everyone should hear from. Now, as everybody knows, we are a 501c3 nonprofit, and we could not do this without the support of our sponsors and our donors. So a big thank you to United Healthcare and McCarthy Law. Here's a message from McCarthy Law.
Here at McCarthy Law, we practice in the areas of estate planning, long-term care planning, elder care law, and residential real estate. Our focus is really on providing peace of mind to our clients.
If you're interested in scheduling a consultation with our office, you can feel free to reach out to us at 401-541-5540. You can also reach out via website at www.mccarthylawri.com. You also should check out our social media, both on Facebook, Instagram, and LinkedIn for some helpful tips and tricks.
Welcome, Linda Hurley, President and CEO of CODAC. How are you?
I'm good, thank you. I'm honored to be here. Thank you very much.
Yeah, so I just shared with everybody that I'm a bit of a fangirl because you are such an expert in your field. So for those folks who are watching who might not be familiar, could you share what it is that you do, a bit about yourself and about CODAC?
Okay, well, I'm the president and CEO of CODAC Healthcare. What CODAC, I'll share about CODAC first. CODAC since 1971 has been the primary provider in the state for opioid use disorder, which I'm sure most people that hear the word CODAC, CODAC, that's what they associate. But we are actually an integrated community healthcare center now. So we have a tremendous, one of our specialties, of course, is substance use disorders and medicine for those substance use disorders. But we provide many, many other services that are actually exciting to me, because we can't, it isn't possible to treat someone who comes to us and says, I've been on 6 medicines and I really like to drink. I drank my whole life. And now all of a sudden I'm feeling differently and I can't stop taking the pills, and I don't want to stop drinking. Like, that's a real problem. And it's very, very, very common. It's so common as we age, and you can see me, I'm aging here. As we age, we change. And so you can't just say, okay, you can have this medicine for that medicine for that, and we'll see you in 2 weeks. There's a whole piece of our lives that need to be looked at. What's happening with us medically, what's happening with us, from a counseling perspective, what's happening with us in a social perspective. grandkids have grown and gone to college, and nobody's home at all anymore all day long, and all these things are happening, and my life is changing. So what we've brought together is what's called an integrated care system. And that system looks at people's medical or biological needs. We look at their social needs, how you're feeling, and we look at the other part of social needs, which are, is your housing safe? If you're on a fixed income, do you have enough heat? Like, these are all pieces that we incorporate into one care center, and we have great collaborators to do so. So that's who CODAC is right now. I've been in the field for 40 years. This was my third profession. And when I found it, I liked it and I stayed. And we've, CODAC has been a first in the field for substance use disorder nationally and internationally. I don't think people often know that in Rhode Island, but we've really been, and the reason we're often first is because our strategic planning has always been centered on what the community tells us they need. So if there's a trend in a different substance, if there's a trend in age, a trend in demographic, we create programming for that. And that very often is not the case for many, many providers. So we're very excited to hold that position.
I love that you're driven by what the community is identifying as their needs. So often it is, here is the solution. You must fit in this box. And the reality is what the individual needs or the community needs is really like over here in this little circle. And so, programs can miss the mark if they're not having that community conversation. It's one of the things that I've always appreciated when I see you speak and in the different programs that you offer is that you do look at it from the global scale to what is happening right outside the door. That's so critical to being able to help people, because if you're not providing a message and you're not communicating in a way that's relevant for individuals, they're not going to hear you, even if the message is important and needed. As we get older, like, so many of us, like you said, like, these really big life changes. We retire, and then it's like, okay, well, what am I doing every day?
Mm-hmm.
We get sick, and then sometimes we lose the people who are close to us, and those things can really have an impact. And for individuals maybe who are in recovery from a substance use disorder, those things all kind of interplay. How can these changes affect mental health and substance use? And particularly for our older adults, there are some stigmas around like getting help and asking for help. How does CODAC address all of those things?
Well, it goes back to what I was saying, like what the community need. If someone comes to us and they admit, and sometimes it's like admitting, we hold our shame so much inside and stigma inside, so, I have to say, I know I'm depressed. Well, a whole bunch of us are, to varying degrees. And in this current social environment of ups and downs, no matter, what side of the aisle you may be supporting, everybody has ups and downs every day. And so that's almost like throwing, I can't remember the phrase for it, but it's almost like throwing extra fertilizer out there for your fears, There's
a lot of fertilizer being thrown out there.
But anyway, in my own experience and with my, I was a caregiver for my parents, both of them. And I got so tired of hearing the term, well, that's just geriatric depression. I'm fretting right now. I'm wringing my hands even saying it. The amount of loss that we experience, and especially, well, not especially, but if someone has had a history of substance use on and off, all kinds of loss has occurred. Sometimes it's loss of custody of children. Other times it's loss of respect of family members, but there's loss after loss after loss, loss of your own self-value. And, often we start to, it turns around and you have hope and you're healing from it. And you wake up one day and suddenly things are changing again. And that's really hard. That's if you've had a history of substance use disorder and these big changes are happening again. And it may be retirement. It may be choosing to, what do they call that? Sizing down. You don't need the 4 bedrooms anymore. You're just going to get a nice little condo and travel, or you're on a fixed income and you didn't plan, like maybe some of us didn't plan well enough. So you have to downsize. All these things it's like, oh my goodness, what was my thinking? Now I'm sad. I miss my home. I miss this. I miss that. Loss, loss, loss. And almost all of geriatric depression, if you have that diagnosis, being explained to you, almost all of it has to do with loss. And it's loss that everybody experiences. So I beg people, honestly, not to get caught up in what that diagnosis means. It means you've had a lot of loss, you're really sad, and you're afraid you're going to do something that's not going to help yourself because you feel so bad. And that's the way we approach it. That's exactly how we approach it.
And I love that you talk about the loss, because I think sometimes there's this misperception that as we get older, that when you lose a loved one, that it's supposed to be different for you. If you're 23 and you lose your sibling, everybody understands if you're crushed and heartbroken. But for some reason, many people think if you're 87 and lose your sibling, that you're supposed to just kind of, that happens. And
you're lucky you've had them so long.
Yeah.
And the reality is, having a sibling that long actually makes the void greater than there's a shock and a trauma if I'm 24 years old. If I'm 84 years old, that's a 60-year relationship that leaves a gap, a giant gap in my life. And you lose witnesses to who you are. Like your parents go, and then, and then siblings die and friends die and old friends die. And suddenly, you're taking a drive and you want to remember something and there's nobody to ask.
Yep.
To me, I still get goosebumps at that feeling,
Yeah.
And we don't prepare for it. Nobody prepares us for it. We don't have talks about this.
No.
And we need to, but we don't. And so we're not prepared for it. And I don't think that we have a very strong support group yet to be able to help us through it.
Yeah, you're absolutely right. But depression is not something that is necessarily a normal part of aging. And there are treatments available to help individuals. But before someone seeks treatment, what are some of the signs that families or caregivers should pay attention to that maybe my loved one needs some help, some professional help?
Yeah. And these are across the board. You've probably heard them before, but it is when somebody seems to become listless, someone seems to not have as much interest in what they used to love, staring out the window, not liking TV shows anymore, sleeping too much, losing their appetite. The things that used to be fun and exciting aren't anymore across the board. And sometimes people get angry. That's not the most common, but sometimes people start to get angry more. They're angry at the loss as opposed to, incorporating it in a way that just increases emptiness. And so those are, when anger pops up that doesn't over response to situations, over response in terms of anger is a big clue, a really big clue. So if a caregiver or a family member or a loved one is seeing these shifts, it's great to talk to them, talk to the individual about it. Like, this is what I see. I see this different for you. It's not how I've seen you respond before, and we can take you, or you can go and talk to somebody about it that is a professional, and they could maybe be able to help you. And it is, and quite frankly, I'm a firm believer in medicine or pharmacological intervention. Very firm believer. It just needs to be done well, as directed, with someone who is competent in creating the diagnosis and prescribing. So when you have that, it works beautifully. Because sometimes we just have too much. It's like being in a well, tripping and falling down in a well. And all you can see is a tiny little bit of light at the top, and it's not enough light to give you hope. And then something happens and somebody puts a big old ladder down there, and you start to climb up, and the hope gets brighter and brighter. That ladder is an antidepressant medication and having somebody to talk to. You don't have to take it forever. You just need to get out of the hole.
It's medicine that helps. Mental health is health. Now, for those people who aren't really familiar with CODAC, what kinds of mental health and substance use services does CODAC offer, and how can older adults access them?
Okay. Well, what kind of services we offer? We offer all of the services in actually 8 different places now across the state. And
super important.
yeah, really, it's wonderful. And so that's nice to know. And we do offer the integrated care services. Now, here where my office is now is at 45 Royal Little. Sorry, my house is 44. 45 Royal Little Drive here in Providence. But again, we have Cranston and other Providence, East Providence, Newport, South County, Woonsocket, and we're also in the prison. So
you actually have spots over 2 bridges. You have one at East Providence over the Washington Bridge and Newport over the Newport Bridge.
Yeah.
And South County. Y'all are wild and crazy.
When I started, we had 3, but the need is great. And again, we always look at the need, and we move where the need is. Yeah. And so these integrated services, if you come to us, say you come here to Royal Little, and you have a number of problems, and you don't even know where to begin. Well, what hurts the most? And if your foot hurts and you don't have enough food tonight, we're going to give you food, and we're going to connect you with podiatry, with someone who can come here, or if it really hurts, we can take you there to their place. And then, okay, and why'd you come here? Oh, because you've been feeling sad and you haven't drank in 20 years and you think you might start, and you really don't want to, but it's coming close. And then we have counselors here that can address that right away. We have doctors, we have pharmacists, we have nurse practitioners, we have nurses, people that will know if you need medicine. If you need medicine for to prevent a relapse, if you need medicine for alcohol use you're already involved in and it's a problem, or stimulant use and it's now a problem. And of course, if you have a problem with pain medicines or other opiates, we have medicine and we have great treatment. And all of that care really is nationally known. We've developed tremendous programming around that. And we have a great deal of understanding around how these treatments change as we age. For example, may I give an example? Do we have time?
Absolutely.
Okay. So alcohol. Women have a full third less of something called an enzyme, acetaldehyde dehydrogenase. Don't remember it. Just know we have a whole third less. And that is the enzyme. That is the warrior in our systems that breaks down a molecule of alcohol. A full third less than men do. So women have a full third less. So alcohol stays a whole molecule with us more than men. And it's that much more poisonous for us when we drink it because the whole molecule runs around, wrecks the brain, wrecks the liver, does all of that stuff. It also impacts our endocrinology. So women have even less of that enzyme premenstrually. We almost run out of it postmenopausally. So there's all these different stages for, women that those of us that have been using alcohol throughout our lives, where it has impacted us differently. And that's an oversimplification, but it's real.
Yep.
And the same is true with men. We need to be gender specific, and we need to focus. We need to pay attention to the developmental or the biological age of people. When you come in, this is what's going on. It's just, and it has always been under recognized. And we pay a great deal of attention to this.
It's the family secret. Nobody talks about it. And it's always interesting. I talk to many families and they'll mention in passing that, mom or dad maybe has a glass of wine with lunch and then cocktail hour and a couple drinks before bed every day. And folks don't realize that when it comes to drinking alcohol on a regular basis, if you have a medical event that, say, requires you to go to the emergency room, say, I hate to deal in stereotype, but stereotype, you fall and you break your hip. Maybe you just slipped in the shower, not alcohol related. When your body doesn't get the alcohol on its regular basis, there can be some medical events that come along with that. But because we don't talk about using substances and what our parents or loved ones may or may not do in the privacy of their home, as they're sitting in the emergency room waiting to be seen, that detoxing can start happening. And there can be some other biological things that are taking place that the emergency room really needs to know about. And folks don't necessarily realize that.
An example, just as an example that's fairly common, if you only have, and what you described was 2 cocktails and a glass of wine, if you only have 5 ounces of alcohol a day, if you had been drinking more throughout your life, that seems like nothing. And it just calms you down. And you don't, if you're not working anymore, you don't have to worry about taking care of babies or taking care of budgets. You can just chill, and that feels good. What ends up happening is when we drink alcohol, it dehydrates us. Okay. It dehydrates us. So if you happen to have some kind of COPD or heart issue, anything that you need to pay attention to, when you stop drinking, you start getting more fluid. And in 24 hours in a hospital, you can start to have fluid around your heart and lungs because you didn't tell anybody that I drink about 5 ounces of alcohol every day.
I did not realize that. That's excellent information.
Well, it's a good example because it's real, I don't get intoxicated every day. I used to drink so much more. Back in the 60s, I had 2 martini lunches. All that stuff goes down.
Yeah, exactly.
But this is our bodies now. This is our bodies now, and we're not the same. And there's actually 2 enzymes that for men, they're less as we get older too. But for women, they're dramatically less. So that alcohol is such a poison for us, And I have to tell you, I'm honest. I mean, I love a glass of wine, and I certainly cannot. I can't. I'm on certain medicines, and I'll have 1 glass probably once a week, just because it doesn't work well with the meds I'm on.
Many medications do not play well with alcohol.
Mm-hmm.
If someone listening today is thinking, I'm not sure I'm ready for treatment, what are some maybe gentle ways CODAC can still offer support, education, guidance for them or their family?
One thing is, often when we say, I don't think if you're saying, I don't think I'm ready yet, there is a seed somewhere in that yet. And so I would suggest, look at our website. We have, and there's an anonymous place in which to ask a question. And we'll be able to answer that question. So if you have a question, just ask it. And we have people we have tremendous staff. I have to tell, I'm so proud of who works with us. And of course, we have 8 sites and 250 people work for us. I can't guarantee that we're all perfect, but we really have tremendous staff. Our doctors are wonderful. We have several ASAM, American Society of Addiction Medicine docs who are boarded that have passed this board that says I can work with you. I love this medicine for frankly for your age group. We're aging. I'm aging. We're aging, and so I love it when somebody says you're who I want to work with. And just another example for if you're a woman. Once we're not of childbearing years anymore, who asks us? Does our primary care doc say, have you had a GYN appointment lately? When's the last time anybody asked you that? We can still get cervical cancer. Just because we're old doesn't mean we can't get cervical cancer. That's the stuff. So just reach out and have a conversation.
Yeah.
Just ask any question. It doesn't have to be about depression or anxiety or about your use. Like, oh my goodness, I drank 2 wines last night and I got this new medicine. I was loopy, ask whatever you want. Just start a conversation with us. And often it's easier, remotely like this. We also do telehealth. So you don't have to come in. You can just reach out. The number's on the website. And I'm happy to provide you the information, Deb, when you can provide it and put it out there for folks. And just have a conversation. The person that picks up the phone might call it a consultation. Trust me, it's just a conversation. It's not going to cost you a lot of money. It's not going to cost you money. It's your insurance premiums aren't going to go up. Medicare is not going to yell at you. Just,
that's what I wanted to ask. What insurance do you take? Or what if people don't have insurance?
We have a grant with the Rhode Island Department of Behavioral Health, Developmental Disabilities and Hospital. It's called BHDDH. We have a grant that covers uninsured and underinsured. So if you can't pay, if perhaps you're unsure of your citizenship status. None of that matters. You don't have to give us that, and we'll be able to provide services.
That's good, because I know that for purchasing health insurance through the exchange, ages 55 to 64 at, I believe it's 400% of the federal poverty level. Individuals in that category were the ones that were going to be experiencing the largest premium increase for their health insurance. So I think, a lot of folks who are not Medicare eligible and not Medicaid eligible may have some difficulties getting the care that they need because of financial reasons. So for individual, how about our veteran community? Are you able to serve our veteran community too?
We are. So we do that on a case-by-case basis, but we have had a long-standing relationship with the veteran community. And some of that has to do with us being throughout the state. And, the Veterans Administration doesn't want to create a hardship for individuals to have to drive an hour to Providence to get the services that they need. So again, just call, have a conversation, ask the question, and we can work it out. We really do not deny services. We just don't. And we have staff. I'm just going to, and please, I have to worry about being ageist in the other direction just because that's happening to me. But, I've experienced people who have remarkable competence. However, they have not been on the planet very long.
Yes.
And so it makes it very difficult to, can you excuse me just one moment?
Sure.
Excuse me, sir. Could you give me about 15 or 20 more minutes? Thank you. I do so apologize. I didn't realize.
And I apologize because I said I was going to keep you for 15 minutes and I've taken you almost more than twice that.
Oh, I'm having a great time. Anyway, so remarkable competence, but they haven't had certain experiences. And I did not feel a level of comfort in terms of their life experience. And I mean, a lot of very young people are very wise, and a lot of very old people are not wise. But there's a piece of I find that it is important to have staff that are culturally congruent, not just with ethnicity, but also with age, also with gender. It's often important with gender. We need that cultural congruence to feel comfortable, to be able to even say something like, I don't know, television as opposed to TV or monitor, or just little things, but we start to feel isolated because language is different. It's very real.
Yeah, it's very different if you say, what were you doing when Kennedy got shot? What were you doing when 9/11 happened? And the person you're talking to has no point of reference for either.
Yeah. I shared this, just an aside, and this is another real example. Earlier today, our marketing crew was here. They were very sweet. And the young woman said she went to the Newport Folk Festival. She's always gone. And she's gone for 10 years in a row. And I thought, that's so cool. And so we started talking about it because my sister and I have been going since, every year since 1984. So I said that. And then I said, oh my goodness, Sarah, were you born in 84? And she goes, no. So, that's funny. We shared music and that's all that mattered. But,
tickets are going on sale, by the way, I think in the next week. I've volunteered there for almost 15 years. I missed last summer, but I love the Folk and Jazz Festival.
I do too.
Yeah. Since I've kept you so long, I do have a quick question. Is Kodak a nonprofit? And if so, how can people support this important work that you guys are doing?
Kodak is a nonprofit. And historically, because we were incorporated in 71, and people recognize us on one of our sites on Huntington Ave that is pretty much a physical metaphor for stigma, for, treating substance use disorder. And so we have always had difficulty raising funds. I am thrilled that our new website easily invites people to donate. And if someone does want to donate, they can just go on the website, and that's great. That's fine. And that's probably the easiest way. We accept every kind of donation you want to provide. If you want to send a check. And we of course have folks, mostly it's folks that have had a family member or they have been in treatment and they respect the work we do. That's where we get most of our donations.
Awesome. And how about if someone is in recovery and they would like to offer support to other people in recovery or seeking recovery? Do you have open positions? Do you need volunteers? Do you need people to help share the word on social media? We need it all. And honestly, we do. We collaborate and also have our own peer recovery group. I would love to have folks, and many of those folks are 60 and older, but I would love to have that age group, become more substantial, more folks. Because it's important. It's very important. We have individuals that have been with, they're 82 and 84 that have been with us for a long time, and they need so much support. It's incredible. And the medicines that we provide have changed for them through the years. They've been with us 40 years. They're not getting the same medicines at the same dosages because our bodies change. And it's important to have a provider who understands that across the age spectrum and across an individual's needs. Yeah. Yep. Yeah. Linda, I'm so glad that you were able to stay longer. I know somebody's waiting for you, and I'm a huge fan of the work that you do and the way that you do it by really listening to the community first. So I'm so grateful that you came on today, and I hope you'll come back on in the future. Oh, I'd love to. I'm happy to. This is very important to me. Very important. Yes. So thank you for what you do as well. And please, again, to everybody, please, it's just easy to contact us and talk. Just talk. Thank you. Thank you. Everybody, Linda is an amazing CEO. Kodak has amazing programs. As Linda said, they are spread out across the state. You can reach out at any time. Their website is kodakinc.org. And whether you or a loved one is struggling with a multitude of things, whether that is a substance use disorder or mental health, as Linda said, as we age, sometimes we are facing a lot of losses in our own life. And sometimes that includes when we are caregiving for other people. Some of what Linda described are things that caregivers can encounter as well, that depression and that anger. Kodak is there for you as well. So please don't hesitate to reach out. They take insurances, and if you don't have insurance, you are welcome at Kodak. I am so glad that you have stayed to watch this very important conversation today. This is one of those things that impacts so many people across the state, across the country, and it's a topic that we don't talk about. It usually falls, sadly, in the conversation of family secrets. And it's important for folks to know that when they're looking for help, that help is available. So thank you for joining me this week. I look forward to seeing you all again next week. In the meantime, be well and be kind.